Here is my audience. You guys can go have a seat. 1 in 5 families with children in Minnesota are faced with hunger or food insecurity every single day. Take a look at all the kids in your own neighborhood, and at least one of them is hungry right now. Recipients of Minnesota Public Assistance Programs should not be subject to mandatory drug testing to determine or maintain their eligibility for public assistance programs. We will first discuss the problem with drug testing, and then we will talk about how this can be resolved. So let's begin by looking at the problem with mandatory drug testing of public assistance recipients to determine or maintain their eligibility for certain programs. Participants who have had a positive drug test will lose their public assistance benefits for the entire month and every month thereafter until they have a negative test result. According to Chun and Puneni, they created a report for the Minnesota state legislators to help them understand the different public assistance programs and all the requirements. If you had a felony within the last 10 years, it doesn't start when you are out of jail or your sentence is beginning. It starts when you are done. So as soon as you are done with probation, that's when your 10 years starts. It will be mandatory and is mandatory in the state of Minnesota to be subject to mandatory drug testing at any given time. And if you are new to the public assistance programs and you don't have a felony, then you'll be subject to just random testing whenever the county calls on it. If you fail a drug test, your benefits are going to stop immediately and they will not start again until you have a clean test. Many Minnesotans are under the impression that people on welfare are the drug users just because they're poor. In actuality, it is about this many people out of a big, huge pot. Just to give you an idea. The negative impact on this law on our families is alarming. According to the Health Research Funding of Minnesota, this is not just a local problem. This is a state and national problem as well. For every 5 families in Minnesota, 1 is going hungry, according to the Hunger Solutions of Minnesota. Kids lack proper nutrition, which in turn leads them to lack physical and mental health as well, according to the research funding in Minnesota. Kids are more active in the summer months, so they're just out running around. And when you don't have proper nutrition, your schoolwork is lacking because you can't concentrate. You might get teased because people hear your stomach rumbling. If benefits are cut on school break, kids go without 2 essential meals a day, according to the USDA. For a lot of our families who are on public assistance programs, they do receive free school lunch, and that is their main meals of the day. So heaven forbid their food benefits get cut in the summertime, because for the summer these kids are only getting usually 1 meal a day. And these kids become undernourished very, very quickly. Now that we understand the problem with mandatory drug testing of public assistance recipients, let's take a step forward and discuss how we can correct this. Drug testing should not have an impact on the amount of support a family receives just because their family failed a drug test. It should only be used to rehab these addicts. If you fail a drug test, you should be required to attend treatment, not take away the food from your family. Drug addicts lack the ability of support and the availability of support. This could just be added to regular case management. Our local social service agencies are already working one-on-one with these families, So this should not add any additional costs to any state or local agencies. This could be easily adapted in these communities. This has not been used in other states, but Minnesota can lead by example. No one wants kids to go hungry, especially kids we know. It just doesn't make sense to take food away from kids just because their parents failed a drug test. The public will support this because no one wants kids going hungry. 1 in 5 families with children are going hungry every single day. If drug testing is going to be mandatory, well, let's address the need for rehabilitation instead of taking away food. Recipients of Minnesota public assistance programs should not be subject to mandatory drug testing to determine or maintain their eligibility of said programs. No child should have to go hungry just because their parent or parents has used drugs in the past or continue to use drugs now.